Odisha has been hailed globally as a leader in disaster management. Even the UN has hailed the Odisha government leadership for its disaster handling. Odisha's response to the pandemic was also equally effective, was proactive, with strong leadership at the helm. When the COVID-19 pandemic struck our country, more strongly during the second wave in the summer of 2021, vaccines were our only respite to protect our gigantic population. Although there were initial hitches in the country as well as in the state of Odisha, we have made remarkable progress ever since. As of today, Odisha has vaccinated 94% of its eligible population with at least the first dose and close to 83% of its population with the second dose. Booster shots have also been administered and will pick up pace. The other notable achievement of the state has been that its capital, Bhubaneswar, was the first city in the country to be vaccinated 100% by August 2021. The state government has played a commendable role in this regard. It has leveraged the strength of all stakeholders, civil society, private players, and engaged them innovatively, which ultimately has led to fruitful achievements. To target people with disability, I'll give an example. To target people with disabilities and those living in remote locations, vaccination vans equipped with all requisite staff and items were started. Citizens could give request for these vans for this delivery by calling a number, and the district administration would do the needful. Odisha is also a state where people living in the hills and the tribal blocks, because we have 22.8% of our population as tribals and living in remote and in hilly terrain. So, with the help of civil society, government also reached out to these people in the remote and hilly pockets. Apart from COVID, it is also important to mention that Odisha has become the only state in the country to achieve 0.5% of immunization under the mission Indradhanush, which is highest in the country. Even in the COVID response, the state government partnered with more than 30 hospitals having around 6,000 beds, probably one of the highest on a per capita basis in the country. In April 2021, the state not only met its demand but also sent hundreds of metric tons of medical oxygen to other states like UP, Maharashtra, Karnataka upon the request of those state leadership. And all of this was directly monitored and coordinated by the Honorable Chief Minister, Sri Naveen Patnaik. The economic response of the state has also been equally encouraging. Anticipating massive work and livelihood loss during the pandemic, Odisha was one of the early movers in terms of releasing advance payment of critical health professionals and frontline workers. The state government announced a package of Rs 3,200 crore for the food security and social welfare of its citizens and construction workers. This included advance payment of rice for 3 months, Rs 1,000 each to 94 lakh families, advance payment of pensions to 48 lakh pensioners of the state under different social security schemes, disbursement of financial assistance worth Rs 1,500 to 22 lakh construction workers. It was also the first state to have a post-lockdown plan. Anticipating reverse migration, nearly 6,800 Gram Panchayats were asked to take on oath to take care of the migrant workers upon their return. Also, Odisha Livelihood Mission, banking correspondents, the BCs, reached out to remote villages to provide banking services during the lockdown. So, to conclude, I really compliment and commend the COVID response of the state of Odisha. As has always been the case over the last 20 years, Odisha has proved time and again that it is a global leader when it comes to disaster response, and COVID has been the latest example of that success. Thank you.